Lancaster General Hospital in Lancaster, Pennsylvania is a Level 2 trauma center. It was accredited through the PA Trauma Systems Foundation and was one of the first trauma centers verified in the state of Pennsylvania.
We're going to show you the inner workings of the trauma circle. You'll see the journey a patient may take through the hospital if they sustain a traumatic injury.
Trauma patients usually arrive via ambulance with EMS. The ambulances come into the ambulance bay and patients are then admitted to the emergency department. Occasionally, patients will arrive by helicopter. The patient is being transported to the hospital. The EMS notify the hospital's emergency department physician, who will decide whether the patient meets the highest activation criteria of trauma, the code T, or a lower level trauma activation, a trauma alert. The charge nurse will write the type of injury and potential injuries of the arriving patient on the whiteboard so that the trauma team is aware of what kind of patient is coming into the hospital. When the EMS team arrives at the emergency department, they will bring the patient to the trauma bay to hand off to the trauma team. Trauma care is very much a team effort. The emergency department physician will usually manage the patient's airways. The trauma surgeon and advanced practitioner will manage ABCs in definitive care and diagnostic workup. Our resuscitation area has full capabilities to perform a number of procedures that are necessary to take care of any life-threatening injury that we encounter. In addition, we have a portable overhead system that provides real-time x-rays, which are developed and available for review within seconds of being taken. We have all the advanced resuscitation capabilities here, all that would be necessary in a major trauma resuscitation. Adjacent to this trauma bay is another major resuscitation area so that we can take care of multiple patients coming in at the same time. We have a well-established backup system so we can handle multiple casualties. Trauma surgeons are available to come in and help out as needed. We also have the capability of placing additional patients into the main emergency department area of the hospital, where our emergency department colleagues are available to help out as needed. The emergency department has over 170,000 annual visits, making it one of the busiest emergency departments in the state of Pennsylvania. We have an experienced and empathetic group of chaplains who are available to assist families and patients with any questions or messages that may be necessary. They provide spiritual support for their patients and their loved ones. Other services that may assist in trauma resuscitation include radiology, the blood bank, and laboratory. Security is available to ensure there is a secure area for the patient and staff in case of any ongoing criminal investigations. There are several ED nurses who participate in the resuscitation of a trauma patient. The majority of our patients sustain blunt injuries, and because of that, our workup would involve a trip to the CT scanner to look for any internal injuries. Trauma patients have priority access to the scanner in our busy ED. Part of the hospital's commitment to the trauma program is the guarantee to provide resources for optimal care of the patient. An example of this is our state-of-the-art operating room. It is spacious and has the capability of handling multiple combined procedures. Doing multiple procedures in one operating room optimizes the patient's time in the OR and minimizes the time a patient is under anesthesia. This operating room is totally dedicated to trauma and is never used for any other reason. It is staffed 24 hours a day and is available at a moment's notice. Our Trauma Intensive Care Unit is a dedicated unit for the care of the severely injured trauma patients. The nursing staff has additional qualifications in trauma care in order to participate in the management of the patients here. It is a one-on-one, semi-enclosed unit. The unit was actually designed by nurses, so it is very patient-friendly. Each room has its own pull-out couch for family members to sleep on, individual patient commodes, as well as a very spacious window. Each room has its own latitude arm to which monitors are attached. We have the ability to do almost any kind of monitoring that would be required for a trauma patient. One of the advantages of being a state-of-the-art Level 2 trauma center is that we can do many of the procedures that normally would be done in the operating room at the bedside. This keeps the patient in a secure environment in case any complications would occur. Our rounds in the intensive care unit are multidisciplinary and include case managers, nurses, doctors, and a critical care pharmacist. The pharmacist advises doctors on the best pharmaceutical needs of the trauma patient. Once a patient becomes stable, he or she will be moved out of the ICU to one of the regular floors prior to discharge. The nurses in the ICU and throughout the hospital are magnet-level nurses. The magnet status is achieved by less than 10% of the hospitals in the United States. An important part of a patient's recovery is rehabilitation. We have a physical therapy arena with a group of physical therapy and occupational therapy partners who are knowledgeable in the needs of a trauma patient. After trauma patients are discharged to home or another facility, they will frequently require follow-up visits to make sure they are recovering from their injuries. Our trauma clinic is available for patients to come in and see doctors or advanced practitioners.
We're a dedicated team whose passion is saving lives. Equipped with the latest technology, we are here to help you or your loved ones in case of a traumatic event.